Hi, my name is Rob Southern. I am 27. I was born with a bilateral complete cleft lip and palate, and I had the Lefort 1 procedure done in 2004 when I was 21. And I guess I would have to say my biggest concerns going into the operation were around, first and foremost, would I like the outcome and be happy with it, which I did. I'm happy with it. And, how painful was it going to be? What was the swelling going to be like? How mobile was I going to be? How long was the recovery process going to be? How many nights in the hospital? That kind of thing. And also food and nutrition after the surgery. I would say that the pain management and just keeping me comfortable were a huge focus of the whole team in the hospital in the first couple days after the procedure, and they really go out of their way to make you as comfortable as possible. And basically, when you wake up and all those people are around you, you pretty quickly realize that it's it's over, and you're just gonna, the worst of it's behind you, and you're gonna wait it out, and you get to be more and more comfortable with it over time. So it's not as though if there's a several week recovery process that all of that is miserable by any stretch. As far as pain due to the procedure went, I was visited by a pain management team in the hospital pretty much immediately after I woke up, and they have you rate how you're feeling on a scale of 1 to 10, and 2 or 3 doctors confer, and they make sure you get the right prescription and that there's always a nurse available to help you out. And so I think for that reason I was never really in a bad situation. And the swelling also was another one of my concerns. It was significant, but it went down, after the procedure. The vast majority of it went away pretty quickly. And so, it wasn't long before I sort of got used to that and got over it, and wasn't really thinking about it anymore after the procedure. As far as mobility goes, I was pretty much stayed in bed for several days, about a week. I also had the Lefort done via osteogenesis and with the halo, which was on my head for about 7 weeks. I think they've shortened that dramatically. It's probably half of that, all I know at this point. And by the end of that time, I was walking around town. I played golf with the thing on, so it really was. That also speaks to the comfort of the whole situation. They had me on the right medication. It was not comfortable just to have it on, or not too uncomfortable to have it on, and I was able to swing a golf club. So, it could have been a lot worse. As far as food went, it's not ideal, but I was able to eat soft foods, and even by the end of the 2 months, I was on slightly mushier foods that were more bearable, and quickly got to a more normal diet after that. I did lose some weight in that 2-month period, but you're pretty excited to have the ability to eat whatever you want after that recovery period's over, so you gain that weight back, I found pretty quickly. And all in all, that recovery time was it was the 7 weeks of having the halo on, which again is probably much shorter now, and then on top of that, 1 or 2 weeks for swelling to go down after having that taken off. Before I was feeling much better, back to my old self. So after I got home, I was, I settled in pretty quickly and was comfortable. My parents were very helpful and supportive. They sort of reverted to treating me the way they did when I was littler and stayed at home all the time, which was really nice. Um, we found that if there were any questions we had for the doctors, or if anything came up and we needed their help, they were always available. We had their phone number, or we could go in and see them for a short visit in the few weeks after the surgery. And same went for the hospital in general. Getting any supplies or anything from the pharmacy to help keep me comfortable at home, help me with pain management or sleeping. So that was all pretty much taken care of really, really well by the team of people that were all assigned to help me out. And that was pretty consistent with what the doctors had told me going into it. Beforehand, they had prepared me for what they were going to do, and they described, they'd done this many times before, and they knew what they were doing, and they really do have it down to a science, which is nice. And when if anything comes up, they can always tell you exactly what's going on and how to readjust expectations or what they need to do to keep things on track. So I always felt like I was being taken care of very well. So I had the surgery done between my junior and senior year of college, and I had told a bunch of my close friends that it was happening. And over the summer, several of them visited me in the hospital and at home just afterwards, and then of course they were really supportive and helpful, and they're mostly just interested and want to be a good friend and help out however they could, which was great. And then when I went back to school, people, my friends at school who I hadn't seen all summer, they definitely noticed the difference. They noticed that I didn't have the underbite anymore, and I would show them, because when I bit into a cheeseburger, I wouldn't pull the whole meat patty out. I would just have a nice clean bite. That was very exciting for me. Big plus of having the whole thing done. And there was not really much of an adjustment period in terms of them getting used to me. It was mostly me getting used to my own new look, and that also happened. The more I realized that it wasn't something that was really obvious to other people that they were concerned about or thinking about, the quicker I got over it, and the quicker it became. I got to the point where it just wasn't really something I was thinking about anymore, and I could just kind of be happy with the outcome and feel good about it, which is the way I feel now.